Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things you should be aware of before using Pristiq or Desvenlafaxine. Number 1, medications like Pristiq take some time to work. They don't work overnight. After you start taking this medication, it's said that you should notice some benefit in 1 to 2 weeks, but it could take 1 month or even maybe 2 months, sometimes longer, to realize maximum benefit. For this reason, it's really important not to give up on the medication in the early phase of therapy, but really try to make it to that 2-month mark before you make the decision on whether or not this is the right medication for you. Having said this though, some patients will need to discontinue early due to side effects. Some side effects that may cause patients to stop using Pristiq early may be sexual side effects such as erectile dysfunction or fatigue and possibly insomnia, which both happen roughly 10% of the time, as well as some patients may experience a worsening of anxiety. So it should be noted that there can be an increase in anxiety in the early phase of therapy with Pristiq and other medications like it. However, this side effect typically resolved after some time when the body gets used to the medication. Number 2, there is a black box warning associated with Pristiq. This warning is really meant for all antidepressants, which makes it apply to Pristiq. Antidepressants have increased the risk of suicidal thinking and behavior in children, adolescents, and young adults in short-term studies. These studies did not show an increased risk in suicidality with antidepressants in individuals 24 or older. And there was actually a reduction in risk of suicidality when compared to placebo in patients 65 years of age or older. Therefore, we must monitor all patients using antidepressants closely for clinical worsening, changes in behavior, or suicidality. You can expect your physician and pharmacy team to ask questions about your mood during follow-up appointments with your physician or trips to the pharmacy to pick up a refill. Journaling to keep track of changes in mood can be beneficial when going to physician appointments. You have concrete information to share with your physician so they can make better informed decisions of how to move your plan forward. And number 3, when should you take a dose of Pristiq? I'll start by saying all decisions in terms of when you take your dose should be made with your healthcare team. When discussing this with your healthcare team, the decision may be made to take your dose based on what side effects you're experiencing. I mentioned earlier that insomnia and fatigue can both happen with Pristiq. Fatigue can happen 9 to 11% of the time, and fatigue happens in about 9 to 15% of patients. So if a patient is taking their dose in the morning but experiencing fatigue all day long, it may be more appropriate for that patient to take their dose at bedtime. On the flip side, if a patient is taking their dose at bedtime and they experience insomnia, it may be better for them to take it in the morning to try to avoid the insomnia. But again, these decisions will be made with your physician during a follow-up appointment. That's all we're going to discuss today with Pristiq or Desvenlafaxine. But before I take off, I wanted to quickly let you know that you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.